Thanks for tuning in to Season 4 of Strange, Rare, and Peculiar Homeopathy Podcast, where homeopathy lives, breathes, and evolves with Denise Strages and Alastair Gray. We'll be exploring modern practice, research, and philosophy, from Hahnemann's radical insights to today's breakthroughs and discoveries. Get ready for homeopathy woes, feedback from pros, and the more you knows.
Evening, afternoon, morning.
Hello. Here we are. I got a full cup of tea today, which is really nice, but you took the pot, didn't you?
No, the pot's in the kitchen.
Oh. So neither one of us gets a second cup.
Well, I don't know. If you go on a rant, then I'll be able to get up, go around, go about my business.
You know how to set me off, so it shouldn't be difficult. Hey, introduce yourself. We should do this every time.
My name is Alastair Charles Gray, and I am delighted to be here with you. I'm the Academic Director of the Academy of Homeopathy Education and the Research Director at Hom Foundation Research Office.
And I am Denise Strages, and I am the President and Clinical Director of the Academy of Homeopathy Education and the founder of the Institute for the Advancement of Homeopathy, which is inclusive of the research office that Al just mentioned. And we also have our clinics. We have HHN, Homeopathy Help Now, which provides acute care, chronic care, as well as complex care with fully vetted practitioners, and palliative and end-of-life care through our Comfort Care program.
We just had a birthday, right?
We just had a birthday, and we totally forgot to celebrate it. So we had our 6th birthday of HHN last month in March, and we have seen, since we started in 2020, so we started this clinical initiative in response to the COVID pandemic, and we really hit a stride with infrastructure. We realized that all the Capricorns and Virgos that work in our organization really love things to be set up nicely and organized. And so it has created this incredible kind of, I don't know, infrastructure it's a word that, I don't know, that's the only word I can think of for it. But what's exciting about it is that
She means spreadsheets, back
well,
ends.
not just that, but we have a portal system. So we're trying to get homeopathy practice moved into the most professional level that we can. And so to comply with HIPAA, the Patient Privacy Act. So we've got this great portal system. We created this universal health inventory form so that all the cases come in, we're collecting data on that end, and then we have our outcomes-based research. And guess what? The number of cases that we've seen since 2020, and this is not since we started as our own organization in 2015, this is just since 2020, we've seen 3,800 chronic cases and 5,900 acute cases. That's pretty amazing.
That is 58. It's almost 9,000 folks.
Yeah. That's pretty exciting. And so,
it is.
Yeah.
Happy birthday to us.
Yeah, I love it. We also had another exciting thing, which is we got our accreditation in Australia for Arrow.
Damn.
Yeah.
Did we ever? The Australian Register of Homeopaths. God bless them. Tier 1.
Tier 1. We're the only Tier 1 school in the world. With Arrow.
And that means that you good folks that are beaming in from God's country, that means that you've got an option to study Hahnemannian homeopathy, soup to nuts, and join the professional association and the register in Australia, and do it in a time zone that kind of works for you.
Yeah, and a lot of people say, well, there's a lot of newfangled homeopathy out there. We need new interpretations. Nope. And I'll tell you how we know that. The reason I can make that noise with such confidence is that we, as I mentioned before, with our clinical cases, we measure the outcome for every single case that comes through. And we use a validated instrument called the MyCaw, and we collect data for long-term so that we only consider using information that can be because we have an ethics board that we report to, and all the things. So we've got to be really clean with our data. So for example, if a person comes in and they've got a cough and we give them a remedy and then we have one follow-up and they're doing really well, we cannot use that information unless we close out the case and understand where that case ended up. And so that means that our numbers, our improvement numbers with our clients, which are between 84% and almost 87% which is amazing, using single remedy Hahnemannian homeopathy. Those numbers would be higher if we included everything. So we're not just going on social media and saying, hey, we did da 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 da, and get a client testimonial after 5 minutes, but actually looking at these cases long term to understand how difficult, not how difficult, but like it takes a bit, like healing of a human body, especially one with a complex, chronic issue, takes time. Anyway, so that's really exciting. Yeah, Arrow. Thanks, Arrow.
I don't know if we mentioned, but that also comes on the back of a now completely signed off reaccreditation process for the good folks at the ACHINA.
That's right.
The Accrediting Commission for Homeopathy in North America.
Yep. And we've got 5 years before we have to do it again. It's like a colonoscopy, getting the 5-year mark.
It was actually like a colonoscopy. That's actually a really good analogy.
So, yeah.
So has a good look.
It's really, yeah. So that was a lot, but it's good. It's done. And actually they gave us some really, really positive feedback about the thoroughness of the work. And I think it's important just to say this because right now there, as it happens all the time, the non-accredited school population, rather than get into conversation and all of us working together to sort of figure out the best way forward, they splintered off, formed yet another organization, and you may have received an email from some of these folks. I don't want to name the organization. I don't want to give it airtime, but they talked about NAHI, the North American Homeopathy Examiners, in what I would call a beyond disparaging way. There were a lot of false claims made about accreditation, accredited schools, and about NAHI in particular. So the folks at NAHI they have corrected all of the misinformation that has already been put forth, and they asked for a retraction of that information, and not one person on the board of the organization that has been founded has replied to them. So
yeah, but you're not surprised about that, surely.
I mean, I'm not surprised after the things that they've done.
Given a person on that board sent a fake potential student to one of our open houses. Do you remember?
Not only that, but one of those board members who shall remain nameless, who owns a school that must consider us as competition, sent someone to pretend to be sick to come to our teaching clinic. And that person felt so guilty that they came clean and they apologized.
Yeah,
that
10 minutes into it.
They were like, I'm sorry, because they had been told that we were the trolls under the bridge, which at the time our school was kind of under a bridge. We were in Dumbo, but yeah, under the Manhattan Bridge overpass. But yeah, so anyway, so look, this is it. People can do what they want. It's fine. But I think that putting true information out there is important. And so if you're interested in learning more about accreditation, why it's important, we've done a few episodes on accreditation. Maybe we'll have it in the show notes, but please look at that and know that really false information has been put out about NAHI. And the NAHI folks have stepped up to create an exam after the CHC, we loved the CHC for, more than 20 years. I carried the credential, but they dropped the requirement of accreditation. So that's really, yeah, it's a bummer because we believe that in order for the profession to go forward, we need accredited schools. We need the accreditors. Wait, here comes Al. He left and now he's bringing me more tea. I've hardly drunk any, but thank you.
How about that, folks?
That's really nice. Look, there he is in a new window. Anyway, but I think part of the last thing I'll say about accreditation, and then we'll get on to our regularly scheduled programming for today. But the thing about accreditation is that you want to make sure as a consumer, because it's a lot of consumer protection in there. In other words, a school has to have a surety bond. It has to have policies in place if there is a grievance, if a student withdraws. There have to be clear documentation about all of the policies. The handbook is reviewed. And so that is all part of you have to be licensed in order to be accredited. And then the accrediting body, there are lots of schools that are getting accreditation by non-homeopathy accreditors, but I think that's iffy because you can pretend that homeopathy is just like this fluffy sort of thing. You don't need a lot of clinical hours. We put our faith in the accreditors that know about homeopathy, that are looking at understanding of what it takes to become a safe and effective.
You're understanding that. Folks, educational accreditation is a stamp of quality, and it's a stamp that the organization knows how to deliver what they say they're going to deliver, and they know how to reflect, gather data, and learn from it in a self-review process. It's universal. It's ubiquitous around the world of education globally, not just homeopathy, but every form of educational institution engages in it. And just because it's hard doesn't mean it's dumb or it's stupid or whatever it is. It is difficult, but it's not impossible. And of course, if folks that understood education realize that they can have their colleges, but with appropriate educational pathways to an accredited school, that means that their students can stay with them and then later join from the pathway, join the accredited school to finish off their study and engage in the profession. It's not rocket science, folks.
Well,
And what's
there's
going
no
on?
resistance from the accredited schools. So all that the accredited schools are asking that everybody meet a standard. It's fine. I don't want to waste any more time talking about it, but I wanted to put out there.
Oh,
No, because I mean, there's plenty that's been said, but false information once again has been put out there. And this has happened. I mean, just to finish it off, we had to get a lawyer some years ago. Another person who is part of this organization was so slanderous to us. And actually, this really got me. Said the only reason that our school got accredited and that I was successful was because I was married to Al. And Al used to be the president of Achina, and that I cheated in the accreditation process because I was married to him. And I'll tell you what, I lost it, because you're not going to tell me that my work is only valid because I happen to be married to a man. That's just crap. And I'm going to stand on my own 2 feet. So this is the kind of, it's like dirty pool, and it's silly. Just like, do your work, people. Let's all do our work together in service to homeopathy. And don't hide behind saying that you've got an organization that includes everyone when we were not included or spoken to about it and then subsequently slandered. I mean, to me, that's not community. All right, let's talk about homeopathy though, because
yay.
Sweden. Yeah, Sweden. So
Hi, Sweden.
Hi, Sweden. We didn't finish everything last time. But I think we mostly did. But one of the things so last time we were talking about 4th edition prescribing, and we were talking about case management. And one of the questions that Sweden asked about was sort of the 4th edition, give a dose and wait, and the 6th edition, what Hahnemann came to at the end of his life with the final publication of the Organon. So we talked about that in the last episode. And this one of the things that we didn't talk about was a question that was asked that's great. They say, my homeopath has told me that psychotherapy and chiropractic/deep massage may intervene negatively with homeopathy. What are your opinions?
A big fat no and a big fat yes. And the big fat yes is that over the years, I think most homeopaths would have got somewhat frustrated when an incredibly effective treatment has been instigated on top of your beautiful treatment plan that's been traveling on really nicely, thus upsetting the apple cart. And I think it's the fact that traditional Chinese medicine, chiropractic work, incredibly effective, really, really useful adjuncts to homeopathy, when conducted in a standalone fashion, are sometimes augmented by other techniques. And so it's the same with homeopathy. If someone's getting homeopathy and has a treatment plan, if someone is getting homeopathy and there's a treatment plan and the unraveling of the chronic disease, and then a deep tissue massage or some dental work happens or some chiropractic, I've definitely seen that that's upset my treatment plan.
Wait, hold everything.
In a couple of situations.
Okay. Dental work for sure, for a variety of reasons we'll talk about. Deep tissue massage? Do you mean like a release of sort of toxins and emotions and stuff? Or what are you
talking about? Rolfing and that kind of action.
Yeah, talk to me about this, because I would have said no to that. Psychotherapy is an interesting one that we could talk about, and acupuncture and traditional Chinese medicine.
Usually augmenting. They almost always augment, but every now and again, because of the depth of the work, every now and again, yeah, I've totally seen that, my pulsatilla or whatever, my remedy is affected, is altered. I've seen it in a number of situations in my own practice.
Massage?
deep tissue, not
Really?
a go
Okay.
for a massage. No.
Look, I mean, far be it from me. I'm just curious because I would have said
Oh,
that
fifth from
massage.
you.
Okay, fair enough. I would definitely have something to say. But no, I'm just trying to think of the mechanism by which, because I could totally see like dental work 100% can throw cases off, but you can get them back. But it's like sometimes I'll have a
No.
client where I'll say, can you wait a month? Let's get over this hump. Or you've got a new remedy, you're doing really well, especially someone who's had some real crises. Like you might say, let's just be mindful because whether it's from the drilling, the nervous system, whether it's the bacteria that's released, whether it's because someone needs to have, antibiotics or something subsequent to a procedure, any of those things could impact. Like that's, to me, that's kind of a no-brainer. But, and psychotherapy is always an interesting one because I mean, I can remember being a student and hearing, or like in the early days, hearing people like on the conference circuit talk about psychotherapy as being potentially suppressive. And I don't really think so. But I would say that sometimes therapy, like when someone does a lot of therapy and they speak in therapy language,
Totally.
or right, someone, do you remember I had a case of a guy, like a super nice guy, and I think I didn't do a great job with him because he spoke like with his the Myers-Briggs, not Myers-Briggs. What's the one where you are
EMDF.
that's the one. What is it? The
I think it is Myers-Briggs.
the enneagram.
Oh yeah.
That's what it is, the enneagram and the vagus nerve. He spoke to me through the language through which he understood what was happening with him. His enneagram. So he would say, "Well, of course I'm like this because I am," or right. And that sometimes is hard to cut through that, but I don't think that's because of the psychotherapist. I mean, in that case, it was probably a me problem, I'm going to say. But do you know what I mean? Do you think psychotherapy can be suppressive?
I've certainly seen it ineffective, with decades and decades of talk therapy and not a lot of progress,
Right.
which is hastened mightily with a dose of a homeopathic remedy or two. But I think you might have cut me off just as I was getting to the point where I was about to
What's
say,
getting
but
all worked up?
well,
Because I
you got all worked up.
Well, because because you were lumping together things that I think are in totally different categories. Like in my mind, I like things lined up. There are certain things that operate on the sort of same energetic level as the homeopathy. I'd put
Well, in
acupuncture
that case, put the shamanism and
shamanism.
Chinese medicine.
Yeah, I'd put that there. And I'd probably put conscious altering things like what is it I have in the freezer that I got for my birthday? Someone gave me. And we
Psilocybin.
Yeah, someone gifted me a bottle of psilocybin for my birthday a year and a half ago now, and I didn't know what to do with it. I'm not going to tell you, so I put it in the freezer, along with the names of the people that have been problematic in our lives. We have them in a bag in the freezer,
Yeah.
along with the gluten-free frozen bread and popsicles.
Anywho, that doesn't matter so much. But what I think I just want to say, and getting to the end, in my experience, in my own experience of practice, that's all I'm saying. Absolutely, every now and again. So not generally, not a lot, every now and again, there is a treatment which is in addition to my treatment, which messes with my treatment. And I've seen that. I don't like it. You got to deal with it. Then you move on. For the most part, psychotherapy and homeopathy, chiropractic and homeopathy, bodywork and homeopathy, absolutely integrative, perfect, and great. But, it just doesn't work sometimes when there's a lack of communication between the two practitioners, especially when you're dealing with the chronic
Yeah.
disease and the energetic component of the chronic disease. So
I'll give an example, acupuncture. So acupuncture, if we're talking about like, good acupuncture where it's ostensibly working at the same level as the homeopathy. So you've got a person who comes for hormonal issues who goes to the acupuncturist and the homeopath. And depending on, well, like let's say that the homeopath gives a remedy and then they go to the acupuncturist while the remedy is in its, in its main time of action, then the acupuncturist might be picking up on the movement of the vital force and therefore would be interfering with that movement. But let's give it a completely different example. which would be, let's say, someone who has had a hysterectomy or has had breast cancer and is on tamoxifen. So they've gone into menopause, just bang, right? So they've been put into an artificial menopause and they've got all kinds of side effects from that. Well, as Hahnemann would say, you can only have one disease. But if you have both, you have the dynamic disease, the chronic disease, and then you have what would be in the category of the surgical disease, right? The lack of production of hormones or the suppression of hormones would be, a medicinal disease. Then the acupuncturist might be able to do some peripheral or symptomatic relief.
Sure.
If they understand what they're doing, but they need to, because I feel like the acupuncturist can drive that really nicely, and then it can work beautifully with the homeopathy. Would you agree with that?
Yeah, I'll give you that. Yep.
Okay. Now, what about something like EMDR?
Perfect.
See, no, I would say that EMDR might be, well, and actually, would I say this from my own self?
No. I'm saying perfect in this exactly the same way that I said before. I've had folks that are tapping away to their heart's content, and it's integrative, and it really helps them with their little explosions of anxiety throughout the day.
That's different. Tapping and EMDR are different.
Yeah, well, so and then every now and again things get in the way, and it may just be because of, as you said, identifying different aspects of the case.
Yeah.
But yeah,
I'm getting on your nerves today, aren't I?
no, not at all. No.
Oh, I'm sorry.
But I do want to get to what I think is the next topic, which is the one that I prepared for. So
Oh, wait, but so EMDR though is that I had to look up, make sure I had the right acronym. Eye movement desensitization and reprocessing.
Yeah.
Right. And it's to work with PTSD. And so I can't imagine how it's suppressive. I'm sure somebody will write in and give us an example of how it might be suppressive, but
I think anything can be suppressive. Religion, in some cases, and spiritual practice, and seeing a therapist, and getting homeopathy, all can be suppressive in some circumstances. It's up to the user and hopefully the observer, the skilled helping observer, to stay away from those waters.
So Hahnemann, if you're thinking about how does Hahnemann look at these other therapies? So at the end of the Organon,
He was all about it.
Yeah.
AHE is changing the face of homeopathy education by raising the bar through rigorous academics and unparalleled clinical training delivered live through the soulful use of cutting-edge technology. AHE prepares its students to become fully rounded homeopathic practitioners from anywhere in the world. Apply today at ahe.online.
He talks about the dynamic power of magnets, electricity, and galvanism. He talks about mesmerism, animal magnetism, or mesmerism. And I'll tell you what, if you want to, there's some great books about Mesmer. I read a novel about him because when I was doing my history of medicine, my graduate studies, we studied Mesmer for a little while, and it's really cool because we studied it in the development of anesthesia block, because there was a time when mesmerism was used as anesthesia before ether could be, before people could be stabilized on ether. Anyway, but Hahnemann says this curative power, well, he says that mesmerism differs in nature from all other medicine. This curative power, often foolishly denied or reviled for an entire century, is a wonderful, priceless gift of God granted to humanity. The life force of a healthy mesmerist gifted with this power dynamically streams into another human being by means of touch, or even without it, indeed at some distance. So he's basically talking about what we might in today's terms call Reiki or something else. And so there are times when Hahnemann uses examples of how you can just move the energy along, especially when a person is really sensitive. Yeah. Anyway.
I have always been in admiration of Francis Treuhertz's stunning book on Hahnemann. And in it, I was gobsmacked to read some of the letters that Hahnemann wrote to his patients. And yeah, you've stolen my copy.
No, this is my copy.
Yeah. And in it, at the beginning, because I think it's a period of about 5 years where Francis did the translation and got the letters in some order. But in addition to homeopathic remedies, Hahnemann was suggesting another 5 minutes of sparks, or another course of your electricity, or whatever the language used was. And at a time where I, perceived Hahnemann to be, a prescriber of pills only, or of repeated liquid doses only, I was really amazed to see the way in which he integrated mesmerism, and of course he talks about massaging homeopathic remedies into the calf muscles. You know that?
I've never seen that. No.
I think it's in the final aphorism. If you want to really speed the cure, rub the remedy on the legs and the calf muscles. It might even be the groin as well. I don't know about that.
Maybe I was just... Here, the last aphorisms are on baths. I like this, the footnote to 289D. A robust 10-year-old country lad, due to a minor indisposition, was treated one morning by a so-called strokestress, like someone who does the strokes of energy, who repeatedly passed both tips of her thumbs very powerfully from the pit of his stomach out under his ribs, and he fell at once, deathly pale, into such an unconsciousness and immobility that with all due exertion one could not awaken him, and he was almost taken for dead. I then had his older brother give him as rapid a negative pass as possible from the top of his head down over his feet, and he immediately regained consciousness and became lively and well.
How about that?
Isn't that great? I found the sparks thing in
Yeah, read us a couple of examples.
Yeah, this is Francis Troyhart's book. It's called The Genius of Homeopathy. So this is, he's writing to this guy. He says, let me know if you have your electric machine in the house. I would very much like Secretary Kaiser to make a trial of electricity. Be so good as to help him to it. He's rather clumsy, but deserves compassion. I would charge him with electricity and draw simple sparks from the renal and cardiac regions. You should get him to come to you. And then he writes again.
Imagine turning up with an electric machine that drew sparks from your rectum.
Well, it's interesting that the remedy electricity, I've often wondered sort of, I've done a little deep dive into all of the early introduction of different remedies, like the north and south poles of the magnet, right? Like electricity, like Sol. Wait, did he do Sol or Luna? Hahnemann did one of them, but not the other.
I think he did. I'm going to say Sol.
Yeah.
I think Sol is one of his.
So he says, my dear Mr. X, I'm very glad that you have seen Mr. Secretary Schroeder. He is an intelligent man. Get him to lend you a spark drawer, the blunt end of which is cased in wood, and when you are charged with electricity, let it be passed all over the weak parts through the clothes. This will cause conduction without your feeling it. He will tell you how to do it, but the machine must be very powerful in order to do you good. This drawing out of sparks must be done with the hand of another person. Let Mr. Schroeder give you slight sparks with the Leyden jar, in order that you may learn how it is done. For when simple drawing out of sparks ceases to have any effect, you must proceed to slight shocks. You can apply to the chilblains in your fingers some petroleum, which you can get from the druggist, which he would have said no to later on, wouldn't he? Petroleum on a chilblain, that would be an external.
Yeah.
This is great. Come soon to see me. For the enclosed thaler, we will feel obliged to you to get for us some butter and 6 good sausages and 6 groschen worth of the dark gray wool for the purpose of darning the women's stockings you sent us, and 6 groschen worth of the pale gray wool similar to that of the 2 pairs of children's socks. Signed, Dr. Hahnemann. And we're recording this on Hahnemann's birthday.
Happy birthday to Sam.
Yeah.
Isn't that interesting?
Yeah. Then he says, here's another one, another letter. Dear Mr. X, when you were electrified, did you stand on an insulator under which there was glass or rosin? That is essential. You ought not to feel shocks. The sparks may be drawn from you with the finger if you find that the ball makes 2 large sparks. And if this should cause heat, then let yourself be charged with electricity for 1/4 of an hour only, whilst you stand on the insulator protected by glass or pitch, without having sparks taken from you. I have sent you a prescription for a powder, of which you will take every morning a heaping teaspoon. We beg you to send us 45 plants of curly kale, 15 of kohlrabi, and 20 of blue cabbage, all with the roots. Enclosed are 16 groschen to pay for them. With thanks for the trouble, yours truly, Dr. Hahnemann.
Isn't that interesting? He's engaging with his clients in a deep way. I
mean, I think it is really interesting, though, these different things that he suggests. And then there are things that he, tells you absolutely do not do. Anywho, but I would definitely suggest to people read the end of the Organon. I love this part on the power of magnets, electricity, and galvanism. And then finally, he ends with the baths of pure water, warm baths and cold baths. Yeah, momentary immersion in cold baths of 7 to 13 degrees Celsius has been found to be a homeopathic aid for a patient's lack of vital heat. I wonder how he would feel about cold plunges.
He'd be fine with them.
Anyway, okay, that was a nice little thing.
Now, isn't there something else in that letter?
No, actually, I think we dealt with all of it. Let me just check and make sure. No, because it was about the 4th edition of the Organon and how you know if a remedy has completed its action, and then is it less possible to cure chronic conditions when prescribing according to the 4th versus 6th. So we talked about all those. All right. So the other thing that we were going to talk about that we mentioned last week, but we didn't get to, was Herring's quote unquote law and direction of cure. Not a law.
Don't get me started.
Don't get me started. Where do you want to begin?
Well, let's just start with the facts, Jack. It's not Herring's law. Herring never said it. He never wrote it. It's attributed to him, and it's not a law. And therefore, at best, it can only be 4 observations of cure. 4 accumulated observations of cure, sometimes erroneously attributed to Herring. How about that? That's the way I would describe it. And it doesn't involve the really important 5th.
What's the 5th?
Well, the 5th is that as people get better, they become more present.
So I almost don't even know where to begin because there are so many problems with the idea of this direction of cure. But let's talk about the ways in which it does make sense, right? Which is you should have, we talked about this a couple of podcasts ago, where that woman wrote in where she has been given a whole bunch of protocols and nosodes, and her original, I think she had Crohn's disease or something, was her original diagnosis, and now she has a seizure disorder and that potassium problem. I forget what it's called, but where she's like precipitous loss of potassium or something. Remember that?
Right. Yeah, I remember.
She's clearly getting sicker. So like what one could say that in the aggregate, the direction of cure should be you're getting better. Overall energy, well-being, mood, all of that should be trending toward feeling better. Within the symptom picture, there is a hierarchy of organs and sort of the intensity of complaints that would have to be addressed. But once you get into sort of complex chronic disease, there's no top to bottom, inside out that happens. But Hahnemann in chronic diseases definitely talks about the sort of insidious beginning of a chronic disease that would have some sort of a skin lesion that would most times go unnoticed. And so I wonder if part of this sort of misappropriation of the terminology comes from the idea that if that superficial skin lesion is suppressed or goes deeper in, and that healing would then take it back out. That seems to be where it probably came from.
And that covers off on 2 of them, because that is exactly what we see in practice a lot of the time, not all the time, but a lot of the time.
Yeah.
And that is where things disappear in the reverse order that they arrived. And just as, a carpet unrolls, as people get better, that unraveling retreats again. And so for me, there's no problem with that. And then therefore that also, so that's the reverse order. But there's also from the inside out, which is, part of what you were just mentioning there. And that's the observation that often happens, often occurs. And that is where things progress from the next part of the healing process, is where the symptoms manifest in a less important part of the body. So in the reverse order, and then from the inside, from the inside to the outside being less important.
If you want to do a deep dive on this, Andre Sain has a great article. The title is Herring's Law, Law, Rule, or Dogma. And it was presented at the second annual session of the Homeopathic Academy of Naturopathic Physicians in Seattle, Washington, April 16th and 17th, 1988. If you just put into your Google machine, Andre Sain, Herring's Law, you'll get it. And it's really interesting because he addresses in a way that I think he does. One of the things he does beautifully well is to go to all the primary source materials to ask questions of the material to see where things come from. And I think he does it gorgeously here. And so the first thing he references is that Kent, in his second lecture, says, quote, and this is in a second lecture that was delivered in 1900 at his postgraduate school, quote, "The cure must proceed from center to circumference. From center to circumference is from above downward, from within outwards, from more important to less important organs, from the head to the hands and feet." And he goes on. And George Vitulkas, in his book, The Science of Homeopathy, creates that infamous cone that every homeopathy student has had to look at. And it's the cone where it's like the mental and emotional stuff is at the top and the inside, and it sort of shows this in diagram form. But there are a couple of important things that are missing, like, and I loved when I found this article because it was reinforcing the way that my lecture notes on this. So, for example, an important issue is that Kent doesn't differentiate between acute and chronic disease. Yeah. And so is he talking about that acutes resolve in that way, or that chronic issues resolve in that way? And I would have to say that if you are looking at how people with complex chronic issues heal, you could say loosely that Herring's Law is appropriate, but not directly, especially the directional point. What do you think about that?
Yeah. I mean, I just think that having those four things in mind is so incredibly useful. Having the fifth, I would say Alastair's fifth, having those five things in mind gives the observer a huge boost, a huge amount of information as to whether the person in front of you is doing better having taken your remedy. Because sometimes, I don't know if you've ever tried to turn around an oil tanker and get it going in the right direction.
Yeah.
It takes a couple of tugboats, a bit of time, and a whole lot of diesel before, boom, off you go. And when the waters are swirling around those early days of treatment, then you've got to have some guidance as to, am I on the right track here? Because if I'm not, I'm going to waste a week. And you don't want to be wasting a week with a remedy which is wide of the mark, But if the engines are spinning, if the wheels are turning, whatever analogy you want to use, and you're just lining things up before the impetus, then up, down, in, out, reverse order, most to the least organs, and is the person speaking to you in the present? Those are really useful. I remember so many times people have come in. I used to observe it from back in the old days where I used to video all of my cases. And so many of them would come in for the second consultation and they'd sit down and they'd say, "How are you?" And I'd just go, big fat tick. Wow. Because when they came in with their fingernail vision and their problems and dramas and illness, it's like almost I was irrelevant. And suddenly, when they ask that question, you realize that the world has expanded somewhat, and whatever analogy you want, the iceberg starts to melt and the energy starts to move.
I like that.
Oh,
Mm.
there you go.
Yeah.
Glad to do. Anywho, Kent, he's an awkward Kent. Herring is an awkward character. Used to be Denise's homeo hipster boyfriend
I know.
until she found out that he was problematic in all sorts of ways.
Yeah, he's a complicated character. I mean, after really spending a lot of time, so my dissertation was largely centered around Herring and Lippe and their frenemy relationship and how Herring was super focused on a more reductionistic paradigm and was in, I don't want to say in conflict with Hahnemann's philosophy, but he says in the third edition of the Organon, the third American edition of the Organon, Herring writes the introduction, and he says that he is, I'm paraphrasing here, that he's, a staunch follower of Hahnemann, and he says, but he's an empiricist first. In other words, he doesn't believe anything until he sees it himself, which I suppose is fair, except if what you see is depending on what you're looking for. And so Herring was so interested in this sort of reductionistic idea. In other words, taking things apart to their smallest component. And once you start to do that, the premises in homeopathy kind of fall apart, don't they?
Well, no, not necessarily. I mean, from my point of view, an empiricist by definition is I know something because I've seen it or I've experienced it. Now, Hahnemann is an empiricist, but so is Herring but Herring's looking down the microscope.
Exactly. That's why I'm saying what you see depends on what you're looking for.
So the two things are not necessarily different or opposed. Herring's experience through looking at his 750-pound microscope.
$750 microscope he bought, the most expensive microscope of its time. Yep.
Yeah. So, he's seeing those bugs swimming around in the blood or the pus or the whatever, and saying, my experience is that this is real. So,
but he was also asking different sets of questions. So, for example, what was I teaching? Oh, I taught last week before we're on spring break this week, but last week I taught about homeopathy and the evolution of science in the 19th century. So a lot of this Herring stuff came up. And Samuel Swan, who is the person responsible for the introduction of many of the nosodes that we use, Swan had written to Herring and asked him if he asked Herring in a letter. Let me actually pull up this letter real quick. I should be able to get it in 1 second here. Well, basically, what happened is that, here, I've got it. Swan, who is such an interesting character. So he writes to Herring and he says, Dear Doctor, while reading an article of yours on Serenum in the second volume of the North American, I was instigated to write to know if you ever potentized septic blood, and if so, would you be kind enough to send me a small quantity of the highest potency that you have? I have a prover desirous of proving it. He has just graduated as a surgeon, and referring to the damage from dissecting wounds, I suggested that a high potency of septic blood would be an antidote, at which he expressed a wish to prove it. And so, of course, that's an isopathic principle. Looking for an antidote is not homeopathic, it's isopathic. Herring writes back and he says, Dear Doctor, your letter of the 2nd came to my hands yesterday. I have never potentized septic blood, every case being different. It may be better to wait until the chemists have taken it in their hands. Wormley in Ohio could if he would. Do you know him? All cases following dissecting wounds get well from arsenic, to which I started screaming, like screaming at the TV kind of thing, because Herring's dissecting wound got better with arsenic. But he says, I suppose ferrum would act complementary if required. We ought to prove some iron from human blood. I got some pus from the variola of sheep, as sheep have more of the sulfocyanate in their saliva, and their smallpox are the most malignant. It would be worthwhile to prove it. Anyway, the reason I bring this up is because notice how quickly the conversation, because this is in 1873, the conversation is in this bioreductionistic model.
Totally.
And so, and so Herring is like, what happens? Well, if we're looking at blood, why prove blood when you can prove ferrum? And Herring actually had this moment, this sort of inductive moment, when he and Lippe, before they're falling out, they did a partial proving of, I always forget which of the 3 crustaceans, because there's Homerus, the lobster, there's Limulus, the horseshoe crab, and there's the crayfish. I think it's going to be lobster. It's going to be Homerus, the lobster, I'm pretty sure. Could be crayfish, but I'm pretty sure it's lobster. Anyway, Herring says he wants to do this proving because he noted that the blood was blue in the creature, and therefore it should have ferrum in it, right? And because cuprum was a useful remedy in the treatment of cholera, he thereby induced that the blood of this creature would also be useful because of the copper component in the blood.
Right.
So that's a brilliant use of inductive reasoning, which, by the way, if anybody wants to do a proving, we need to do full and complete provings of these shellfish, because they've got these, what we know from the partial proving, it looks so much like what we see in these mast cell cases and these anaphylactic allergy and idiopathic anaphylaxis that we're seeing, right? But anyway, but you see how Herring is looking at it. Like, for example, the sulfocyanate in sheep saliva. Well, that was the same thing that he was looking for when he got into the blood, sorry, not the blood, the pus from Suriname, right? So we had the pus that he collected in 1830. In the 1850s, he's looking at it again, and he's looking for the sulfocyanate in it. Yeah.
Isn't it interesting? You're totally right that somehow homeopathy, the science of the day, started to imbue the leaders of homeopathy in different ways.
Yeah.
Lippi went one direction, Herring grabbed it and ran with it. We're a long way from Herring's direction of cure by talking about Herring as a...
Well, I don't know, though, because I think what's interesting is that Herring was looking for these sort of formulaic things, right? But actually, if we go back to Andre's article, which is it's really good. And he goes through where all of the possible places that Herring might have gotten this information from. So, for example, here in 1845, Herring published in the preface of the first American edition of Chronic Diseases an extract of an essay which was never published elsewhere, called the, quote, Guide to the Progressive Development of Homeopathy, in which he writes, quote, every homeopathic physician must have observed that the improvement in pain takes place from above downward, and in diseases from within outward. This is the reason why chronic diseases, if they are thoroughly cured, always terminate in some cutaneous eruption, which differs according to the different constitutions of the patients. And then he says, the thorough cure of a widely ramified chronic disease in the organism is indicated by the most important organs being first relieved. The affection passes off in the order in which the organs had been affected. The more important being relieved first, the less important next, and the skin last. Even the superficial observer will not fail in recognizing this law of order.
Isn't it interesting that we're essentially saying, I mean, if we were following that truly, imagine that this is your dose of phosphorus 200. That's phosphorus 200. You're saying to the bottle, you're looking at the bottle and you're saying to the bottle, hello, bottle of phosphorus 200. I'm now about to give you to a client. I only want you to deal with the deepest parts of the organism first. Don't worry about the superficial stuff. Got it? Okay. Here you go.
Yeah. I mean, there's so many things missing from it, like acute and chronic, like the complexity of disease, the vitality of the patient, how much medical suppression there has been over time, how much vitality they have for healing, right?
Yeah.
I mean, you were helping me by listening to my presentation this morning. So we're recording this a week before the Joint American Conference starts, and I'm presenting on complex autoimmunity. And a big part of my talk is looking at how, over time, science has moved into this reductionistic paradigm and an insistence on causation. And in other words, everything is caused by something else, whereas Hahnemann took the opposite approach and said all disease is dynamic and it arises from an internal miasmatic, susceptibility or the acquisition of a miasm. And so in doing it, looking at all of the diseases, all the disease names, as Hahnemann, lists all the disease names and says these disease names are irrelevant because all of this suffering arises from, the dynamic plane. And so once you start to look at that, I mean, you can sort of make sense. You could sort of flip it and look at it through the lens of chronic diseases, which I think Herring does nicely. right? And of course, Hahnemann changed the order of how symptoms are categorized, right? With the mind being first and the generals being last, right? And I wonder how much that weighs in, because it is in that order, if Herring was influenced by that.
Folks, Denise mentioned her talk. I've heard it now. Well, I've heard this version of the talk 3 times. It is a winner.
Thank you.
It is, I would say, an accumulation of gathered knowledge and other presentations that you've done over time. And to be there. It's going to be great.
Oh, by the time this comes out, I think it.
Saturday week, 8 a.m.
Yeah, Saturday, whatever that date is, the 17th, maybe 18th, something.
I think it's the 18th.
Mm-hmm. What else? I think we did we go through it?
What
Did
else?
we do it?
You're driving.
Am I?
I reckon that's pretty good for today. Thank you for your questions,
Yeah.
Sweden and any other places.
I
Keep
love
them
the
coming.
questions. Yeah. Love.
We did get some feedback about it wouldn't be a bad idea to change the name. Do you remember that?
I know. I am leaning toward a name change. This podcast today was much more serious. I listened to the last time when there was a lot of talk of 1992 and music and.
It's not all about REM,
No, it isn't.
Sometimes it's about snot and poop and most important organs to the least important organs and discharges.
May the snot be with you.
We'll leave it at that.
All right,
folks, you
everybody.
take care.
That's it.